My name is Nicholas Moyer, Executive Director of the Humanitarian Coalition. It was my pleasure this morning to welcome everyone to Canada's first humanitarian conference. And we've had a really extraordinary exchange of ideas today, a lot of ideas put on the table, and frankly not nearly enough time to discuss all of them. And so it's really been a pleasure to welcome everyone today, to see the contributions of so many wonderful panelists and distinguished representatives of our sector. So that said, I think there's been no doubt, and all the commentary I've received is that it's not a question of if, but of when and how we're going to put on the next Canadian Humanitarian Conference. And that's really something that I take on as a proof that there is indeed an appetite for this level of discussion here for us and among us in our sector. And so I really just want to express again my great thanks to IDRC for their contribution today in organizing this event, to all of you for coming and attending. Before I hand over to John DeBoer to give us some final remarks and introduce our esteemed panel here, which I believe is also being broadcast over the web as well today. Thank you very much.
Merci, Nicolas.
Thank you, Nicholas.
CRDI.
Welcome to IDRC. I'm John DeBoer, team leader on governance, security, and justice at IDRC.
It is really our distinct pleasure to welcome you here to talk about the future of humanitarian response. And this event, as Nick mentioned today, follows a day-long discussion about how Canadian and international humanitarian response can be made more effective, accountable, and innovative. And Canada's International Development Research Centre, we truly believe that in order to meet the humanitarian challenges of the 21st century with more effective and fast humanitarian response, the role of research, the role of evidence is critical. And there are a couple of challenges that we see as perhaps new, emerging, perhaps pushing the humanitarian response to levels that it has never experienced before. And those two challenges are, one, the fact that the majority of humanitarian crises and vulnerability is now being witnessed in what we call fragile and conflict-affected states. The second is that there's an increasing trend towards urban contexts in terms of humanitarian response. And this is posing new challenges for a humanitarian community that is traditionally used to working in rural contexts and possibly negotiating with armed actors that are organized and recognized. And instead, you have an environment where humanitarian actors are being forced to negotiate access with non-state armed groups, sometimes organized crime entities. And such, the scale and the nature of the challenges facing the humanitarian community is changing. Now, determining how to respond effectively in densely populated environments where violence intersects with poverty and vulnerability is no simple task. And to do this, humanitarian actors really need to understand what works and what doesn't, and to adjust their policies and practices accordingly. Through research, Canada's International Development Research Centre is starting to engage with a number of humanitarian agencies to see how they are shifting their practices in contexts of high levels of violence. And so we have a couple of projects dealing with looking at cities such as Juarez in Mexico, Rio de Janeiro, Medellin in Colombia, Haiti. What do these contexts of violence mean for humanitarian assistance and actors? And this research, we believe, will equip not just humanitarian actors, but also local governments and local communities with the knowledge of what works and what doesn't. However, this is just the beginning in terms of getting answers to some of the key challenges that the humanitarian community will face. And this panel we have here today will perhaps provide some answers, but also provide some more questions in terms of some key areas that we need to dive deeper into. And for this discussion, I'm going to turn to David Common. We're very excited to have him here. He is the host of CBC's World Report, And he will moderate this discussion with some of Canada's most respected humanitarian experts. Now, David, he is no stranger to conflict, nor is he a stranger to disaster. He has covered many humanitarian crises, including the earthquake in Haiti, the tsunami in Japan. He also has been on tours of duty in Afghanistan and has covered also Iraq. And more recently, he reported from New York, a year ago actually, yesterday, to cover Hurricane Sandy. Now, David has been awarded numerous journalist awards, including Gemini Award for the Best Reportage category. And thus, we are very privileged to have David here to moderate the discussion. So without further ado, what I'm going to do is just hand it over to David so that he can take us away and lead us in this discussion about the future of humanitarian response. Over to you, David.
Well, thanks very much to everyone here in a very wide room. Some of you are going to see more of the back of my head than I usually like to show off. But it's lovely to have you all here. And I'm actually very excited to talk to you now in stereo sound. To be a part of this, it's a fantastic discussion. Everybody's okay? Everybody's all right? That might be me. You'd think the guy who works in TV would get his microphone right, huh? I'm very excited. We're here very much focused on the future of humanitarian action, and so we're going to try to keep the discussion going that way. I'm going to try to talk very, very little, which is totally against my nature, but I want to talk, first of all, just about who these three are, and then give them an opportunity to give you a little bit of a presentation. Then we're going to move on to a discussion in which all of you will have the opportunity to pose questions directly, including some questions that should come in via the web from some robot somewhere, apparently. I'm going to start with François Audet, who comes to us from the Université de Québec at Montréal. You're a professor in the School of Sciences and Management, I understand. You are also a visiting scholar at Harvard, so you're smart, apparently, which is good. You've participated in several humanitarian and technical support programs: Haiti, Colombia, Somalia, Darfur. An incredible resume. I can't go on forever. I'll turn over to Steve Cornish, who is the executive director of Doctors Without Borders, or MSF. He speaks more languages than we have to note, just in the amount of time that I am going to speak. But he was head of mission on country programs in Africa, South America, and the Russian Federation, also having worked for the Canadian Red Cross and Care Canada. And on his left is Denise Burns, who is the executive director for Oxfam-Québec and Club de Tiers. As I understand, for over 20 years, she's been developing and implementing programs both in Canada and in the field in countries in Africa, Asia, and Latin America. So a great panel that we've got here. We're very privileged, and we're going to start with François, who's going to speak in both a bit of English and French to mix it up.
Yeah, that's it. Thank you very much. I will try to look as intelligent as you mentioned. It is. So this is as a researcher that I'm here today to try to briefly introduce some ideas that what I believe is at stake for humanitarian organizations. I wish that my move are not too dangerous for the technology. I will base my presentation, which will be very brief, on of course, on academic literatures, in trying to respond to the questions: what are the challenges of humanitarian organizations in the future of humanitarian response? Pourquoi s'intéresser à...
Why should we be concerned with humanitarian organization? As we've seen today, humanitarian assessment is a very much institutionalized phenomenon, and the humanitarian organizations are at the heart of the system, which is evolving quickly. If we want to improve, to change, we have no choice but to consider the humanitarian organizations.
So, conferences and looking at the states of the planet in general, I think we will all agree that we clearly live in a world that may appear richer, but as well very fragile. Looking at the statistics, we are facing an increase on the frequency and the intensity of natural disaster in one hand, and as well an increase in the complexity of the conflicts. I think Syria is a very good example, or a bad example. So these two trends unfortunately overlapped in many parts of the world that you probably all know, Horn of Africa, Sahel, Haiti, Middle East, and so on. So therefore, there is a trend that countries that are unstable are as well vulnerable to natural disasters. So in this context, humanitarian organizations are likely to be increasingly faced with situations where populations are under what we can call different layers of pressures: demographic pressure, economic forms of pressure from natural disasters, conflict, and so on, climate change, of course. And it appears that the numbers of these situations where we can see multiple types of pressures will increase, and will increase, of course, unfortunately, the vulnerability of the communities around the world. So taking into account what I just presented, we can regroup in, I would say, four main categories, what we can identify as limits or challenges for humanitarian organization in the future. And actually, it's already ongoing. The first one, and I think humanitarian organizations in this room will agree, I think, is certain humanitarian access. As you know, humanitarian access concern, well, two things. First, the humanitarian actors' ability to reach people affected by a crisis, and vice versa, an affected population's ability to access to humanitarian assistance or services. As you know, what is at stake for humanitarian organizations such as Oxfam, IDRC, MSF, is the ability to deliver a humanitarian response that respects fundamental principles that we all know about: impartiality, neutrality, and independence. However, the relevance, the effectiveness, and ultimately the perception of humanitarian action are crucial to gain this acceptance. And as you know today, these principles are under fire. We can even say that they are under a crisis of legitimacy or simply not respected or understood. So this is what I think is about of humanitarian access. The second challenge is what we can regroup under the concept of instrumentalization. Most of the lessons learned from empirical data from the field, even from institutional lessons learned, shows that as long as humanitarian organizations are perceived to be manipulated, to be infiltrated, or appears to be a tool from another realm, such as the political realm, and military realm, or religious realm, their legitimacy will be affected. As you know, in conflict zone, legitimacy is often the only key to open the door to have access to internal displaced people, refugees, or prisoners. And I think that it goes for the humanitarian actors to ensure that they are not perceived as an instrument. The third one is what I would put altogether in the name of humanitarian capacity building. Humanitarian actors are certainly better to respond to crises than at preventing them or preparing them. Literature is rich with articles, paper, and books depicting poor capacity building practice in all types of humanitarian organizations. And I believe that if the aim of humanitarian organization is to reduce human suffering, and we all agree that the basic assumption is that the first to arrive on the scene of a disaster is the local community, well, then a rapid paradigm shift in the intervention methods will be needed. Preparing for the crisis also means to make sure that we will be able to analyze the political and economic context that will shape the nature and the future of the challenges. The last and the fourth one, and the last one, is a very old debate which we can put in the name of coordination or institutional complementarity. Some might say, as I just said, that it's an old debate, but still today, this is the main problem raised in the evaluation of many humanitarian response in the last decades, including Haiti, Iraq, Afghanistan, and so on. I will not here elaborate on that particular issue, but just ask one question. Why are the humanitarian organizations still in some kind of competition in a theater where we all agree that it's preferable and more effective to coordinate themselves or ourselves? So in conclusion, if there is a shared belief that humanitarian action is necessary for the future of humanity, then there is a need to avoid a situation in which I think humanitarian organizations will be responsible to what we can call a fatigue, a credibility fatigue, or an incoherence fatigue. And this fatigue might create, as you know, probably the fact that the donors will be less interested, and as well the public, on humanitarian issues. And because I'm in this group, we all need, that we agree that we need consensus and learning humanitarian organizations to deal with the future challenges that humanity will face. I think that they will need to be able to say yes or no, to accept or no money, to be able to assume that it is sometimes preferable not to respond to a crisis. They will also need to address the problems of the management paradigm, meaning that they are currently managed like private business while they are using their charity personality for marketing. Basically, it's time, I think, that the humanitarian organizations become mature enough to pay the price of what they say they believe, even if it means to lose jobs, to shut down country offices, or even to be able to say no to a donor. Thank you.
Thanks very much. We'll get Stephen Cornish from Doctors Without Borders to pick up now.
So on this theme of the future of humanitarian aid, I'm very pleased to be here and thankful to IDRC, the coalition, to others, to Francois, for organizing this debate in Canada. I think it's long overdue. Many other countries hold these debates, and we haven't had such a rich debate. So first, I'm very pleased to be here. And I think the future, I'll join Francois on the adapting to insecurity and to access issues. I think that's huge. Technology and innovation, of course, are always key, but in a way that they can be used to increase our proximity to patients and to have some caveats that I'll speak about. And finally, the role of witnessing and of how we have to change aid and trade and other types of policies with the different innovations and the different things that we see in the field if we're truly going to have a maximum impact. And a wise man, Lao Tzu, once said that those who have knowledge don't predict, and those who predict don't have knowledge. And as a result, it left me scratching my head because I was supposed to be on a panel this morning, and then they switched me to this one. So I started to ask myself some questions. But all that aside, I think the future is what we make it, and it is up to us to make it, and I don't think we have a choice but to rise to that challenge. And so it makes it all the more worthwhile to have today's debate. I think the last big review of humanitarianism came after some well-publicized failures in Goma, in Bosnia, and in other areas. And this showed some of this lack of coordination that you're speaking of, but also it showed that there were a number of actors that didn't actually have the technical capacity to back up the types of programs they wanted to lead, and led to countless unnecessary deaths. And as a result of that review, there was a standardization and a professionalization which was put in place in the humanitarian community. And that's brought many great things, of course. It raised the bar on quality. It led to better care. But I think it also brought some of the things that we're now trying to look at, of this bureaucratization, this inflexibility. And some of those we have to wonder if we're really better off, or if we're truly able to manage as we go along. But how has this left us then prepared to face tomorrow's challenges? I think that's today's question. And when we look around, I think we can generally agree on some of the main trends that are out there that are sure to lead to growing and increasing needs. Climate change is certainly one of them, and I think people this morning talked about natural disasters and food security, but also the zoonotic complex, which is changing. Vectors are spreading to new areas, and so we have even dengue in Texas and malaria in places where we didn't have it before, and that's leading to a whole set of challenges. So is rapid urbanization. Most of what we've learned in humanitarianism has come from the rural setting. And in the urbanization, not only do you have a faster spread of disease, we have populations that when things go wrong, when the lights go out, are extremely vulnerable and don't have the same coping mechanisms that people have in rural areas. And we saw this very well in Sandy, and I guess you would have seen this too, David. And we're seeing it now in Syria. Another thing to look for, I think, is demographic trends with an aging population and with the rise of middle-income countries. This also changes the types of responses that we have to bring. In Syria, we're needing to put into our emergency medical kits medicine for chronic disease. That brings with it increased complexity, increased cost, But these populations from middle-income countries also have increased needs, and needs that our toolkits aren't always well prepared to respond to. And against what backdrop are we facing these challenges? We're seeing that UN appeals are chronically underfunded, and those underfundings are then passed on to implementing organizations that then have to cut corners and often respond to the easiest to access, and respond even with programming choices that are public health type programming choices or other programming choices that are easier to count and easier to put in place. But are we really reaching the most vulnerable? Are we having the greatest impact under those types of cuts? And that's an open question that we might discuss a little bit more today. And the instrumentalization of aid, I think, is key. And Francois touched upon this, but he touched upon it on a way that pointed at the other. And the other is important in this debate, don't get me wrong. There's a lot of work to be done. And through the war on terror, this with us or against us approach, the idea that traditional humanitarianism was somehow quaint and could no longer protect, could no longer allow activities was widespread. But agencies also played a part in that. Some agencies looked at humanitarianism as mere humanitarianism, only life-saving, and wanted to do too many things with the door that opens. And that door that opens to access is because of impartial assistance, is because of helping only according to need, is because there is no political and no other agenda. And to be considered humanitarian, you have to have that flag. And when you try to do more, you're likely to rile up something. And you might rile up doors that'll close. And what we've seen, not only have our own governments instrumentalized aid, but as a response, other governments, strong states and failed states, have become much more weary of humanitarian aid, thinking that there's something behind it, wondering if it's part of state building or other measures. And so they've increasingly cut off some of that assistance. And we've seen a huge rise in attacks against not only humanitarianism as a result and humanitarians, but also of civilians and civilian structures. And we're seeing that today in Haiti, where hospitals, where schools, and civilians themselves are under attack, as well as anyone who goes towards helping them. And so there's great work to be done. And I think there are three things that we really need to count on in order to face the future. The first is access and protection, and we need a reaffirmation of civilian spaces and international humanitarian law. That's what the other has to do. And the ICRC, MSF, others are trying to work on that. But we have to look at ourselves and our own adaptation. Many organizations look to the UN or look to governments to make their access, to make their security. We have to take that responsibility ourselves. We have to relearn how to negotiate with all parties to the conflict, but also how to have better government relations. Instead of getting smaller, we actually have to get bigger in order to have sort of diplomatic outposts to be able to maneuver all of the bureaucratic impediments to aid in some of these strong states that you can't just drop in and assist. You have to be there the whole time. And if you're not proximate and accompanying the populations in danger, how do you understand the context? How do you understand their needs? And one of the things that technology has brought us in security and communication improvements actually is a bunkerization, which has blocked us off from some of the traditional ways that we understand populations that we work with. It's kept us secure with big cars and radios and high fences, but it's cut us off from understanding the very places we work in and building that acceptance on the ground. The second area is innovation and technology. And when I look at innovation and technology, of course, it holds great promise. But I always, in my mind, I say tech schmeck first, because you've got to be wary of the technological fallacy. And you've got to ensure that the technology that comes is actually going to be low cost, that it's going to democratize aid, that it's going to improve things, make things better, not like the example that I just gave you. And there's a few things that we know that are working very well. We've seen GIS and vector control and in finding water spots. We've seen mobile technology for better helping of distributions and how to get patients on regime, and even telemedicine that's helping bring doctors where there are none. But that's not enough. We also need to use evidence-based programming in the field. And this is something that we can't wait for tomorrow's innovation to help us figure out how to do humanitarian work and save lives. We don't have that luxury to step back. We have to do both at the same time. We've done some of this in HIV and TB we're starting, and I won't go into it because I think we're running out of time, but maybe later. We're bringing e-learning also to the field in order to better train national staff and expats. So we really need to look at how do we roll out evidence-based programming, how do we scale that and pay for it, and donors are not very interested. But we can't just look at the silver bullet of technology and then try to set it into the field and see how it works. And I don't know if I can give one example, and then my last. How am I doing for time? You look nervous, but so I'll just give one quick example because it goes into my last point. One of these things that we've done with technology, how to simplify things and demedicalize things, and bringing nutrition, preventative nutrition, to the community level. And we've done that by reducing costs, by having not a big wide surveillance, but by having micro surveillance, going back to the old-fashioned way with community health workers that can identify those who are sick and those who need special attention in the hunger gap period, and then with an appropriate nutritious food response. We've reduced mortality by over 50%, reduced costs to the level that the Niger government can afford to do this itself. And you'd think that would be enough for that technology to be adapted. We've shown that you need protein-based food, not just fortified blended foods. And fortified blended foods is what generally the World Food Program used to deliver. But it isn't enough because it costs more, because there are some stalwarts that don't want to change and follow that. And so the last thing is that as humanitarians and being in the field, we have another responsibility. That's to bear witness on behalf of those who suffer in silence so they don't die alone, like we've done for Syria, but also to advocate to make the changes in aid and trade policy that we need to see that affect far greater numbers of patients than we can ever see in our clinics or in our refugee camps. So we have to think of the field with a big F, and we have to ensure that we work on changing those policies that affect millions of people around the world. And as I said before, to conclude, we don't have the luxury to wait for a paradigm shift or for a full revolution in humanitarian aid, even though maybe that's what some would like to see. We have to adapt and innovate every day in situ. And if we don't, then there's no way that we're going to ensure humanitarians are better able to cope with tomorrow's challenges, tomorrow's access, and meet tomorrow's needs, and do a better job of it tomorrow than we are doing today. Thank you.
Thanks very much, Steve. Denise Burns from Oxfam-Québec.
Okay, well, I want to thank you, first of all, for inviting me and for organizing the debate. My colleagues said the same thing, and I think that they've done a very good job of setting the table on the issues, the challenges that humanitarian organizations are facing. What I want to do is take a different angle and look at how, as an organization, an international organization like Oxfam, which is 17 Oxfams around the world, is looking at how we're going to meet some of those issues and how we're going to change the way we're working. So we don't have all the answers, that's for sure. But I do agree with some of the points that have been brought up so far. So we know there are more crises happening and they are more complex. And we see that quite clearly in cases like Syria, for example. We also know that there are more refugees right now in the world, 16 million refugees, which is more than we've seen since 1994. So it's not like it's diminishing, but it is more complex. And we're facing more and more situations in fragile states where they're being affected by conflicts and natural disaster at the same time. So those are big challenges. If I talk right now about Oxfam as a family, we're currently responding to 11 major humanitarian crises around the world. It's a huge challenge, but it does bring up the issue of rethinking how we approach the work we do, because as things are becoming more and more crises, more complex, we need to rethink how we act. So we've sort of sat down with others, and we're working with different other international families and other organizations to think about how we can do things differently. And one of the issues for us is looking at how we're an organization that works in humanitarian response. We also work in long-term development, and we also have a strong advocacy capacity to bring about change. So we want to look at how we need to bring those three elements together to be more effective. And so we have sort of developed a vision and five objectives for our vision. And one is more effective and integrated crisis response. So looking at a one program approach where our humanitarian work will link up with our development work to build more resilience of affected people and communities and to build their livelihoods. More fluidity between the different phases, so disaster risk reduction, emergency response, recovery, and resilience. How we're working those things together to diminish some of the risk and the vulnerability in communities. And building this strategy into our response from the beginning to assure more effective programming. Somebody, I think it was my colleague from MSF, mentioned that knowledge of the context, the field, the people we're working with is fundamental. And by working with the long-term development people, we're going to have that knowledge. By working with partners in the field more and building their capacity, as somebody else mentioned, we will also have a better understanding of what people need and giving them a better space where they can express themselves and their needs. The second element is assistance and capacity building. So a mix of, yes, important humanitarian life-saving assistance, but also working more and more through local organizations, partners, and building their capacity. So I agree with what Francois brought up. Strengthening the capacity of these organizations to respond to crisis, looking from the smaller level crisis at the beginning, but building that capacity and continuing to work through them in the longer term. We're going to look at a selected group of countries where we can try and pilot this kind of more consolidated approach. And in particular, some of the middle-income countries where we probably can affect that change more quickly and have a power shift in how humanitarian response is happening. So it's not just the humanitarian organizations coming in, but they're also already working on the ground with other organizations. The third one is resilience, building resilience and disaster risk reduction. So strengthening the resilience of communities through improved disaster preparedness, building their capacity of communities, in particular women's groups who are often doubly affected and doubly marginalized in these situations. So building their capacity to respond to shocks and stresses and to attack the root causes of some of the vulnerability and conflict. We have small experiences that have shown that communities where long-term development resilience programs were happening for food security and innovation on food security, for example, during the Sahel food crisis, some communities were able to hold off for 6 to 7 months before having to ask for any kind of outside assistance, which wasn't the case with communities that were next door. And some of the reason some of them actually had to ask for assistance was because that their long, far-away family from Mali were coming in large numbers, and that sort of created stress. But they had created community food banks and community systems to respond together to the food crisis. The fourth is campaigning and influencing. So I'm joining, again, what you mentioned earlier. So campaigning for the rights of communities who are at risk or affected by conflicts and disasters at the grassroots level, but the national and regional levels as well. Working together with others to bring that message clearly forward. And also increasing the capacity of local actors and state actors. And of course, there's certain situations for that, but building their capacity to respond. They have a responsibility to deliver services to their own populations. So it's an important aspect. But ultimately looking at addressing the real political root causes of vulnerability for populations. So I can't see the people way over there, but and the last is women's rights. And if we want to focus on women's rights, it's because of what I said earlier. We know that women are more vulnerable. They're often marginalized at different levels. They're victims of violence. We need to help them to be actors in their own right, in women's groups as well, but to focus and to bring their particular issues forward to duty bearers who need to be responsible to respond to them. So to make their issues clear, to make the differentiated issues for men and women in conflict and in humanitarian response. So that's a bit of, I guess, the vision we want to put out. It's a big challenge. It's a big shift for humanitarian organizations because traditionally the development end of things, the longer-term development and the humanitarian don't tend to necessarily work together. But I think that's something we think they should be doing, and advocacy should also be working on with them to make things go forward. If I just look at the Syrian crisis, and I just came back recently from there, and so did some other colleagues, two of the main issues are the fact that we have 75% of these refugees who are not in camps. They're in communities. It's a whole different issue to deal with, and it brings up some of the main needs being jobs and sustainable livelihoods, because they're in communities where there's already problems around employment, problems around resources, and they're putting a lot of stress on these communities, and that can bring in conflict. So it's a whole different way of working. We need to be looking at more sustainable solutions for those people, because the situation in Syria is not going to end tomorrow. We know that already. And so they're going to be in these communities for a long time, and they can't just depend on humanitarian aid. So that's just an example of why we need to be changing the way we're looking at these issues. Thank you.
Very good.
Maybe we can actually stick with Syria just for a second. It is the greatest humanitarian crisis of this century, and seemingly, as you well note, only getting worse. How, and particularly for Steve and Denise, how do you actually get to those who need the help and provide it to them in the long term, provide that help that is going to enable them to, in your case, get jobs, to maintain some normality in the midst of all this turmoil?
Little question.
And if you could just summarize it in 30 seconds, that'd be great.
That's great.
Too.
Do you want a PowerPoint too?
Yeah.
Do you want to go first? Or?
Well, I would turn the question around.
Right.
Please.
The humanitarian needs inside Syria are astronomically above our potential. There are almost a handful only of international organizations actually working inside Syria.
And you were talking about creating humanitarian spaces. How do you do that in a place like Syria?
You need to be fully independent and impartial and not have association with any other causes, so that when you're discussing with all of the rebel factions and all of the different actors on the ground, that they will understand your assistance is coming with no other reasoning behind it other than to save lives and to bring assistance to populations that need it. We were unable to get government authorization from Damascus, so we are working cross-border. We have 6 hospitals inside Syria, and so it can be done. It's very difficult, but it can be done. And the fact that there are not more organizations doing it is one of the really big challenges. If we skip to Haiti for a second, during the disasters, and Francois is right to say that they're more and more complex. During the earthquake, we ended up with cholera. There were 100 organizations there responding to health needs. Only 3 responded to cholera, and yet cholera on top was the biggest life-saving need and the biggest need at that time. And so if you don't have the ability to focus in on the most egregious need and to deliver it, that you have to ask yourself some difficult questions as to the value of humanitarian aid.
Why do you think in the case of Haiti there was such a slow response? Was it that it didn't come in the immediate emergency phase and came afterwards? Was it because the UN was getting blamed?
No, there are a few reasons, but a lot of organizations aren't equipped to actually do the curative work. There was so many organizations also working through partners, and working through partners is a great idea, but you don't necessarily have the capacity to respond to what ails the society most. And in a country like Syria right now, the health system has collapsed. Over 30% of the hospitals have been bombed. Humanitarians are under attack. Patients are under attack. So it takes a very special series of adaptations to be able to work. We ended up opening a surgery inside a cave, another in an old farm, one in a house, in order that they wouldn't be distinguished, and that comes with other challenges. But if you're truly going to be a humanitarian and truly respond where it's needed most, you have to be able to negotiate some of these spaces, as difficult as it is, but it can be done.
Just to go back to Syria, and the initial question, obviously a huge problem, as you well note, Steve, inside the country, but 7 figures of people having fled that country. What do you do for them, particularly since they're so diverse and coming into conflict with already resource-scarce regions as they flee?
Well, I think there are a number of issues. I mean, as someone stated, there are more needs than what we can actually respond to at this particular point in time, and we all know that the public funding attempts, not only in Canada but elsewhere, have been quite difficult. Governments, in some cases, have responded better. But I think it has to have different approaches. So you've got a particular approach to working with people in camps, which is quite different than what you're going to do with people in communities. And in communities, you really need to be looking at long-term solutions. So yes, we need humanitarian response, because some of these people are creating, sudden camps with 40 people or 5 families or whatever. But at the same time, you need to be building in what you're going to do longer term, because you want to prevent conflict within these communities. And if you look at Lebanon, where they already had all sorts of refugees, and officially there are no camps, kind of, in some way, we need to reach those people where they are. And in that case, you actually do need to be working with the state actors in Jordan and elsewhere to make sure that there is a consolidated response, because they're dealing with the issues as well. Within Syria, I can't agree more that it's a very delicate situation. And for those organizations that are actually working in Syria, it's very difficult. They have to be very, very, very impartial and careful about what they're doing and saying.
For the refugee question, there's a few issues. One is that as donor countries, we're looking at the situation of containment rather than responding to the rights of refugees. Refugees have a right to basic care. They have a right to food, to shelter, and to health care. Those rights aren't being delivered because donor countries around the world have not responded to the UN appeals. The UN appeal for Lebanon was about a quarter funded several months ago. So if you can only help 1 of 4, this month alone, 200,000 refugees were cut off food assistance in Lebanon. So with that as the backdrop, what we have is we have governments who have a policy of containment for refugee situations. We don't open our hearts and our countries the way we used to do for refugees, and we look at it as charity. As far as individuals, I think we have less empathy for those caught up in conflict because we can't see how conflict could happen to us, and we somehow think they must be responsible. And this is a very difficult conflict with many different actors, so it's very hard to see through it all. But the reality is those people who have fled, 4 million of them, they have many of them been displaced inside repeatedly. They had tried to feed their families, to carry on as best they could through this conflict. They think the international community has abandoned them. And in the end, their last desperate measure was to seek refuge in the surrounding countries. And in Jordan, the international community and the Jordanian government have done a great job at working on some of the issues that you just discussed by having programs for the host community as well, so that you don't end up with these types of conflicts between host community and refugee. But in other countries, assistance according to need is not coming through. And so for Jordan, a few weeks back, they were funded at more than 60%. You have to ask yourself, why is it that France, that Russia, that the US, Canada, why is it that we've funded Lebanon to over 60% and funded, Jordan to over 60% and Lebanon to 25% in the same time when Lebanon has far more refugees? And it's much more difficult to help refugees that are not in a camp setting than the ones who are in the community. So I think there are bigger issues at play.
Well, if I can add, I don't know if my microphone is working. Yeah. If I can add quickly something, I mean, we're talking about Haiti and Syria because they are well known. They're very there's a lot of media attention, and even though that Syria, it's very complex to get in. There's a lot of attention, and even money is coming slowly, but it's coming. But the vast majority of any crisis around the world, natural disaster or conflict, are simply forgotten. The famous forget crisis. And I'm not sure, but I think I remember that the numbers are that only 30% of the global humanitarian need are met by donors in general. So Haiti and tsunami are probably the two exceptions in the last 10 or 15 years. But the vast majority of the humanitarian crisis are just forgotten and they're very limited funding.
What you see there is actually something that we might discuss here because you see in Syria a rise of Islamic charities. You see a rise of diaspora-type assistance, making some of the filling some of the voids that some of the traditional actors aren't able to fill. And I think we do necessarily need to look at the landscape of different types of responses and see how that will affect humanitarianism's going forward.
What is the effect in the future for humanitarian action when you have that kind of those types of groups filling the void?
Well, there's enough work for everyone, as Francois laid out. There is no shortage of need. There is a shortage of response, and so Francois's question of coordination is certainly a good one that can help in that. Certainly not being blind to those things, but on the part of the traditional agencies, we need to be much more responsive, much more nimble. And that's become harder, and that's what I began with. Through this professionalization and this bureaucratization of aid, I think we've become somewhat risk-averse. We've become less nimble and less quick to act. And I think we have to look at ourselves and reinvent how we work as well.
This paradigm shift you speak of. Yeah. Did I sense that you didn't entirely agree with that?
I always agree with Stephen. No, I think he's right. Having said that, the influence of these crises, of these mediatic crises, will be, and if you look at especially of how Afghanistan and Iraq have influenced foreign policies, and how donors and obviously the NGOs that receive money from Western donors have been influenced by what the famous 3D intervention: defense, diplomacy, and development. So those major and important crises, even though that there are very few of them, but they are so important for the Western donors that they influence the rest of the humanitarian intervention. So I mean, it's always a very fragile and tiny line where humanitarian organizations have to, of course, they have to survive. They need money. They need a relationship with donors. But at the other hand, as they both explained, they need their independence and neutrality to be able to deal with the humanitarian access. In Canada, especially, probably that MSF is an exception, but most of the organization depends on the government a lot, which means whether we like it or not, our government or Canada is part of the Western donors in general, and what the U.S. and Europe will do, obviously, we're related to that. So, and because as well, international news, and you probably know that better than me, and humanitarian problems in general are are not very popular in general in the pyramid of interest of the public. It's very difficult for humanitarian organization to get money from the public and then reduce the dependence from donors, which is, I think, the key to get humanitarian access at the end of the day.
It's also just on the flip side of the diaspora and the Islamic charities. One of the things that they've done very well is to be able to enter into some places that Western charities can't because of some of these earlier instrumentalizations. But on the other hand, they're not fully humanitarian. They're not assisting only according to need. They may assist their own home community. They may assist a particular faction of the Muslim population, but not another. And so there's still many, many needs that fall through the cracks that only an independent, neutral, impartial organization would see and would decide to tackle. And in our surgeries, for example, we've seen a growth in other surgeries very focused on war wounded, and will not take pregnant women or will not take burn victims. They'll just leave them aside. And so we've had to actually switch some of our initial war surgeries into more civilian surgeries as those other actors have come along. So we adapt what we're doing to meet the new need, not the need that someone else can. And we're always doing that in every conflict, because you can never meet all of the needs. In Syria, with 2 million displaced and 4 million refugees, you're not going to meet all the needs. We need to concentrate not only on the top layer of UN and of the big ideas, but you've got to work on the bottom up and of really tackling some of the most vulnerable populations and the things that are falling through the cracks. And that way you're meeting life-saving needs, you're accompanying people in their hour of need, and then you need to come away with what you've seen and what you've learned, and to put political and others in front of their responsibilities, both the public for donations, but also governments for the choices that they make around the whole Syrian context and any other emergency context.
I just wanted to pick. Sorry, I wanted to pick on something you mentioned about the long forgotten ones, because that's another big challenge. When I mentioned the number of responses that we have going at one time for different organizations, and I can give the example of the Central African Republic right now, where we've got people hiding out in the jungle, lots of people that are not being reached by anybody, but it's not actually being talked about much at all, and it's very hard for organizations to make choices about where we're going to respond, because the need is in so many places and we don't have necessarily all the resources. So that brings up the issue of how we get more working with different instances, different groups working together, but how do we get that out more and get more response from public, from media around those issues, because that's a place where nobody's really talking about anything, but it's quite serious what's happening there.
But it also talks, though, to this idea of trying to do too much with humanitarian aid. And if you want to do the recovery, and you want to rebuild, and you want to create democracy, and you want to do rights, and you want to do life-saving, all that's going to take how much more money. There is only a certain pool of money, so we can't just be asking for more and more. We have to do things smarter and better, but we also have to make choices. And if we were focusing on the humanitarian, then we're going to have to not be in certain areas, and we're going to have to focalize on more life-saving and necessary assistance in places like Central African Republic, where we're running 3 hospitals despite the violence. But you can't be everywhere and do everything. And if we have this mission creep that we want to do all things with that funding, the funding is already $18 billion. It's 15% of ODA. And there are people on the development side clamoring about how that's being pulled away, and they're probably very right. You also have so many other tensions pulling on resources at the state level that those resources are being frozen in some countries and rolled back in others. So we can't just keep coming with a laundry list of more demands. We also have to look inwardly of how we get more independent, of how we're not going to be too tied into only one source of funding, but have various sources of funding. We also have to find, how do we build empathy with Canadians here, but with people around the world? How do you build that empathy so that they understand what you do, so they want to support you, and be a partner all year long, not just at those crisis moments, because otherwise we're competing against each other. And one of the great initiatives here that you see on the sign is the coalition, who are raising funds and awareness together, so they're no longer in competition. And in the field, you also see much better coordination, although it's still on your list, and I understand why it's there. But if you look back 10 years, you would see a very different picture of far more competition than coordination. And I think the level of coordination has vastly improved. There's always more to be done. But where I differ is between the coordination and a full cooperation, especially when so many organizations are trying to do so many different things, because working alongside them then can also affect how you're seen by the local population. And so if we were to go back to the Islamic charity example, well, if I made a very close relationship in front of the population with one specific Islamic charity that was helping the Shia, not the Sunni, for example, it would be very difficult for me then to be able to bring life-saving aid to both communities. And so you have to watch your external appearance, and that's what you talked about, David, as the perception. Perception is often more important, even if your values are the same, even if you can help each other. You have to coordinate in a way that's not going to hinder the perceptions.
Well, you're probably right that coordination is better now than 10 or 15 years ago with the major, well, I would say the large, typical, traditional organization. But Robert this morning from Oxfam Canada was saying that, I think it was you that said that there's a lot of Mingo, no? My NGO. Basically, it means that there's a lot of small, new organization. Everybody can take a plane tomorrow, go to Haiti and say, we'll rebuild the country. And I would use the word unfortunately, because there's a lot of that. If there's an interest to do something, then give the money to the professional. I'm sorry to say that like this, but as the guy who don't have the hat, I can say it, because unfortunately, when there are major crises and very close, like that, like the tsunami as well, where it was easy to travel. I'm quite sure that we don't see that right now in Syria, but in Haiti and with the tsunami in Southeast Asia, there were too many people doing everything, and that dilutes the capacity and the overall impact of the humanitarian professionals.
That's certainly something we saw in Haiti. I remember the earthquake. You'd had people, once flights started running again, individuals were coming to help, which was all fine and good, but had no idea where to go, didn't have the water to support themselves, let alone do any good for anyone else. I want to get to questions here very quickly, but I did just want to pick up, you were talking about how humanitarian and development have at Oxfam come together in coordination and competition. Sorry?
Working on it.
We're working on it. So I'll start with you, Denise. What's the best example, be it Oxfam or elsewhere, where you have seen competition overcome?
Well, I think I can actually talk about Haiti, because we often talk about Haiti as where a lot of things went wrong, but there were some good things. And I know that there were 4 Oxfams working at that time in Haiti with different strengths. So Oxfam Great Britain were the strongest humanitarian at that time, and they were taking care of the first line response. But you had some other Oxfams who had been there for a long time, who were well rooted with local organizations who were doing a lot of the sensitization work around cholera, for example, because they had access to communities, they had access to people through their local partners, and they were able to train them to do that. So it was a good example of how people can work together to have a better result. So it's just a small thing. Or I mentioned in Niger where working on resilience with communities was then helping to diminish the need for humanitarian response. So that's another way.
Does anyone have any examples of competition overcome that might be useful for the future?
I think there's just a general sense that where it's most difficult to work, you generally have much less competition. You have more exchange. That's clear across the board. And there are a number of examples, but even in Jordan, we're running a surgery program that does reconstructive surgery, and we run that out of a hospital that was started and that belongs to the Jordanian Red Crescent. And so we share services. We do the sterilization for both sides. They do things for both sides, and you overcome then what otherwise would have needed two hospitals to run the same type of program. So there's no shortage of cooperation. It's more of a difficulty in the scale of need and in the choices that we're going to end up making. And when we look at the needs around the world, when we look at what's coming in the future, much less our ability to respond today, then I think we really have to make some choices. We have to look inward. We have to do a better job individually and together. But saying all of that, we also have to be very, very careful to ensure that we'll be able to maintain our access by living up to the humanitarian ideals and the principles which guide our work.
Did you want to add anything? If we do have questions, mics seem to have magically appeared here, which is lovely, and presumably they'll work. You're standing there. You get the first question. Please.
I'm standing here, and I just need to figure.
I think you just talk into it, hopefully.
Yeah,
is that right? Just talk?
Right.
Yes.
Okay, great. Well, thank you very much for a really rich exchange just now. I'm Susan Johnson. I'm with the... how could I not remember? With the Red Cross.
We've heard of them.
Yes. So I'm the head of the international section of the Canadian Red Cross here in Canada. And my question is going to start with Denise, but I'm going to ask if Steve and Francois could also comment. Because I was really interested, Denise, in your description about this bringing development and humanitarian and the advocacy work together. And that's very attractive, or there's many aspects of that I find quite attractive, but there's part of it that, frankly, I find quite worrisome. Mm-hmm. And you can imagine, from a Red Cross perspective, what parts of it I would find worrisome. And I can find it attractive, and I can see in a very, if I can call it benign, natural disaster environment, that could work. But I'm not sure how you bring development, humanitarian, and advocacy together in a conflict situation. And so I'd be interested to hear how you're thinking about that, or what you're imagining that to look like in those kinds of situations. And if Steve and Francois could also comment on that, because I think there's potentially some very serious contradictions there in terms of the true nature of humanitarian action.
And I'm not going to pretend to have all the answers either, because this is a work in progress, right? And that's why I was saying we're going to probably take a few focus places that we're going to try and work on this in, that where the context is appropriate. So I agree with what you're saying, that we have to be careful. But I do think, though, that we have to think differently, because, as it's been quite stated, we're stretched to be able to respond to what keeps coming up. And we need to think about some longer-term solutions to some types of disasters or humanitarian situations. And I agree it's not in all. And when you're for example, working inside Syria right now, I don't think that's something we're going to try and pilot, for example. But I don't have the answers, because it's something we're working on, and we're going to go slowly and take steps and see how we can work together. But for example, we're going to look into having rosters for humanitarian response, where we've trained some of our long-term development people to be part of those teams and to bring in that perspective, to bring in those ideas, to bring in ways of working. So not so much as really training the different people working together. So thinking about rosters that bring in different competencies, but are all trained in the basic humanitarian principles that we need to respect. So it doesn't give all the answer, but it's an example.
Well, I think a good case in point of where that was tried was in Afghanistan, and it showed, in fact, great promise at the beginning with the National Solidarity Program extending a number of multi-mandates and other organizations into the countryside, bringing education, bringing community programs, and really bringing with it the new government, if you like. And for the first year, perhaps it was seen as a model. And even at that time, I think there was some hubris amongst some of the international humanitarian and NGO community who thought that this progress would be best speeded up if NATO would expand into other areas of the country, and that was tried. And unfortunately, then the conflict didn't go as planned, and this humanitarian space was rolled back. And attacks began on schools, and attacks began on humanitarians. And there are, to this day, many areas that organizations used to work in Afghanistan that they've not been able to return to. So I think doing it all together still has a lot of challenges to work out. But I'm not sure that it can't be done at all in the same context. I just figure it's probably best done with different actors. That if you look at what...
Si vous regardez ce que fait l'organisme Scott Gilmore en Afghanistan à l'époque.
The international community was spending more of its resources on Afghan products at the time, rather than importing everything from outside. Well, that could be considered a development function, but I think it was important that it was done by an entity that's what its target was, and that was their view. So I think as humanitarians, we need to be humble. I don't think we own the solutions of how conflicts will unfold and of what tomorrow will bring, but I think we do have to take what we see, take what we witness, and that speaks maybe to the advocacy part. I think we do have to take that and put governments and others in front of their responsibilities. And while the Red Cross has a special mandate to do that in a more confidential way, I think others can do that in both a confidential and a public way, and can sway public opinion sometimes that can actually make a very big difference on the policies that we put in play that actually have very great effect on some of the conflicts in some of the areas that we choose to get involved in.
Maybe quickly, it's an interesting, very interesting and important question, but it raises the necessity to look at every humanitarian crisis on a case-by-case situation. Of course, it is why it's very difficult for an organization to have one main humanitarian policy that will apply everywhere. There is a recipe to respond to every crisis, and we tried that, for a long time, but we all know that now it's impossible. And I think that it's all about institutional complementarity, where what one is doing may affect what the other, and vice versa. Meaning that if MSF is doing something bad somewhere, sometimes it's not about MSF, it's about all the NGOs, all humanitarian sectors, and so on. So, and I think amongst the professionals organization, there is an important respect about that. There's a lot of, I would say, under-the-table negotiation and coordination that we don't see on official meetings to make sure that, well, if I say that tomorrow, will you agree, even if it means that we will need to get out of the country? Will you stay and continue? And we know that it has happened already, this kind of situation where there's negotiation, where one will agree to leave the country or region, making sure that the others will not be affected. But the fact that one have raised a red flag will have shown interest for the media and donors and so on. So it will create probably benefits, but it's a very, very tricky situation, and it's a case-by-case scenario.
It's a big question. Did you want to follow up?
I would love to, but I'm sure there's other people with other questions.
Are they? Oh, yes, there are other people with other questions. If you could identify yourself.
Thank you. I am Ambassador Musa Muhammad, Chargé d'Affaires of Sudan to Canada. And in fact, I learned a lot about the challenges, or at least some challenges are facing the future of the humanitarian work. And as I mentioned, I am from a country which has a long history with humanitarian assistance and work in southern Sudan before the independence in 2011 for more than 40 years, and in Darfur, and I am sure I learned that some, at least from the panelists, they have a good idea or they had been there. And, but definitely, as a country which, as I said, has this long experience, definitely the humanitarian, whether governmental or NGOs, is doing a very valuable and appreciable work in countries and the people in need. Notwithstanding, I want to mention the other side of many allegations or perceptions or shortcomings which they pose against the work of the NGOs or the governmental organizations which are working on the humanitarian assistance. Mainly, number one, I and many others, they think, for instance, in Sudan, humanitarian organizations are working as a humanitarian assistance. Sometimes they contribute in prolonging the conflicts in the areas which they are working. We have in Sudan with many things. Maybe it is, it can be argumental. For instance, the experience of lifeline in southern Sudan in the lifeline. It is this humanitarian project which continues in the 1980s and 1990s in the southern Sudan. This due to what? To the impartiality sometimes, which are done because sometimes some NGOs, they take sides with the conflicting parties. Number two, I think also from the experience in Darfur, despite the very valuable assistance done there, but I think humanitarian assistance in some stage, it will be counterproductive. And we are facing this in Darfur, because in certain stage, the assistance, the humanitarian assistance, contributes to change the recipients, the IDPs or refugees, into dependent persons, and they resist any sort of correcting their position like this. For instance, in Darfur, we are facing the problem in how to convince the IDPs, most of the IDPs, to return to their villages, because they just depended on this ready-made and this food and this thing which had been given to them. In fact, I have a lot, but just one. Also, many also in our countries, or some of them, they think that most of the humanitarian assistance, the fund, go actually to administrative and bureaucratic spending rather than to the needy.
Mr. Ambassador, you've given us a lot to chew on. Is there a specific question that you have? If we're going to respond to this, there's a lot of stuff.
I just want the point of view of at least some of the panelists of what I have said of the allegations. Thank you.
Thank you.
I will start, if you don't mind. It's very interesting, and you're totally right that humanitarian assistance, humanitarian organizations are not always positive in the field or in countries. There is evidence and that shows that sometimes well, not sometimes, but very often in refugee camp, the services that the refugees received are way better than what the population was used to. The population don't want to leave the refugee camp, of course, because of insecurity, or just because also that it's better to be in the refugee camp, and it creates something permanent that was supposed to be very short term. And refugee camp in general are major issues, according to me and according to UNHCR as well, perspective. I think there's a revision of the way that we need to deal with refugees in general. As well, you're totally right to say that sometimes in conflict, especially in conflict, providing aid, support, or contribute to the general economy of the conflict, providing food aid, logistics, interest for many parties, and sometimes there were very few events, violent events, and when humanitarians arrive, then it increased the violence because there's more interest and there is more resources. So, and this is part, and I would certainly let the other talks about that, but this is certainly something that need to be addressed and hopefully study as well to be sure that we try to get a good response. Because at the other side, what shall we do then? We are, just doing nothing, letting people die. It's something that, we can discuss and we can decide to do as well. But as humanity, I'm not sure that we are ready yet to let this kind of situation go and to let people die.
Please.
Yeah, no, I take your points, Mr. Ambassador, and I think it does behoove us to be very careful and to look at the interventions that we put in place. And I can give an example from southern Sudan, where we set up one hospital in a particular area and tried to treat both sides of the conflict in the same hospital, which is fairly common occurrence. But in doing so, we ended up putting some of the patients in that hospital at risk because one side didn't agree that they were there. And those patients then had issue, of course, with the organization, and I think they had every right to do so. And we don't always have enough of an understanding of all the conflict dynamics in the places where we work, precisely because of what Francois mentioned, and that is when there are humanitarian life-saving needs and people are starving to death, or where they're dying of an epidemic, then there requires an urgency of action. But we do have to be conscious about that urgency of action and to balance out an understanding of the areas and that urgency to make sure that we're not the ones who are inadvertently bringing more harm than risk, more harm than good, to the patients that we seek to care for. And you'll be familiar, I think, with an initiative called Do No Harm that Mary Anderson started several years ago. And it really helped a lot of us in the non-governmental organization sector to look more profoundly at our interventions, at our actions, and at our footprint to try to work on just that question that you've brought. So thank you for bringing it.
Denise?
I also think they're very valid points that you have brought out, and maybe the only one we didn't look to was the question of long-term sort of installing people in camps on a longer-term basis. And I think it's a very important point that we have to be looking at beyond the immediate life-saving action. How do we move to something else? And that's that whole issue of the more fluid transition to another situation for people. That's very challenging because of what we mentioned of people, as you mentioned as well, people finding better conditions. But I think we do have to look at things like what was mentioned earlier of local sourcing for food as opposed to bringing in from elsewhere and things like that will move us to something different. But when people have had their basic needs met first, of course. So, they're very valid points.
Thank you very much.
Sir.
Mike Weigert from World Vision. I think we know from experience, we know from research that the success of humanitarian operations are often really tied to the quality of the people, the skills they have there. And so I'm just wondering, what would be your top 2 or 3 skills that you think humanitarian workers need as we face the future?
Well, I was hoping you were going to give us the answer as well as the question, Mike. What we need is more guys like you, clearly. One of the things is, along with the professionalization that has come, is and this complexity is the need for greater training, and it's something that we're trying to also see how to do in situ, so that it's not just packages that people will have, because in fact, even the best training, once you put it to the rubber on the road, never gives you actually the answers to what you're facing. It gives you a few good solutions and maybe a few things to avoid, and that's already a good start. So we're looking at starting, and we have already started e-learning systems where our national staff and our teams in the field can get ongoing coaching. Part of our telemedicine program, where we bring medical skills to those who are in conflict settings that may not have everything in front of them. So you have a doctor who may not have seen a certain pathology. He can put the case description online, and when he wakes up the next morning, he comes back with an answer. Well, maybe it's time that we spread that type of a technical knowledge to some of the socio-political awareness or the conflict awareness or some of the other challenges that we face in the field that we're often left alone to solve. And I think the third thing is, I think we might have had more of that innate ability to adapt, to respond, and to morph into the right types of assistances in the past. And part of technology and part of the security measures, I think, have taken away from that. We now have email and satellite phones, and we're constantly in contact with our headquarters, and they're constantly waiting for us to tell them what to do. And we're building the security apparatus to keep people safe that actually keeps them more separate from the populations that they're seeking to assist. And so I think we have to review the way that we do aid. If we can't protect large field teams, we better go back to having small field teams that can be more mobile, more agile, better linked into the communities that they're serving, able to speak the local language, maybe have less of a grandiose rollout, but be able to stay and be able to use local capacities to the degree possible in order to be able to have many hands do the work. And I think it's really becoming quite urgent, because there are a number of situations around the world where we either can't manipulate as well as we like, or where strong states are demanding differently, so they won't accept 20 outside experts. They're only going to accept 2 or 3. Well, if that's the case, then we have to find ways without compromising on quality and capacity, because the flip side is it's easy to find local partners. It's easy to have a partnership with the government, but are you going to have the same response to the life-saving needs, or are you going to have a more staid response and more emphasis perhaps on the long term? And finding that right mix is not something that we've done, and we don't have the panacea to it, but I think it behooves us all to find it.
Well, I'm not sure that it's so easy to have partnership with the government and not with the local partner as well. It's those partnerships. Yeah, I know, and I'm a fan. Having said that, and I'm not sure that I will respond to your question, but in just to follow what Stephen was saying, we need to be clear that there is around the world more or less 400,000 humanitarian workers, and 350 of them are from the South. So they are not Canadian, they are not French, they are not Americans. They're from your country, and this is, I think, if there's a capacity building, if there's trainings, and I hate to see Western university fighting each other to develop, programs for humanitarian workers where they are not the one who needs to be trained. The ones who need to be trained are in your country, or in Haiti, or in Somalia, and this is where I think there's a need for that. Obviously, and I agree with you that we are not in a situation where we can depend 100% from the southern partners, obviously. But when we talk about shift, when we talk about moving forward, this is where the transition needs to go. This is at least where the evidence base are there.
No, and that's a key and a good point. And one of the things that we've done at MSF is to start associations. We have associations now in South Africa and in Central Africa and in South and Central America, where that talent will grow up and become part of our movement. We have organizations now in Brazil and in India, and the idea of breaking out of the Western mold and that this is a European idea is fundamental to the success of humanitarianism in the future. If we're going to say that these values are universal, they need to look like it. And those who represent the organization and who come up with the new ideas need to be universal, need to be from all the countries around the world. Regionally, we're already depending heavily on, so I'm not sure about your 350. I think it's higher than that. We depend very heavily on staff in Central America to enter into different Central American contexts when there's a disaster. And certainly across the Sahel, we have so many national staff who have learned their trade, who are far more equipped than I am, who then are working in the neighboring countries and bringing those skill sets to bear with a better cultural understanding and a more localized understanding.
Help you build that resilience.
Yeah.
That's exactly the way we're going as well. It's the same route. And I think I look at the floods that happened in India recently, and it's the Oxfam India that's doing the response. It's not Oxfam Great Britain or somebody else. So I think that's, yeah. Great.
Good afternoon, panel. Sorry.
Oh.
During Dr. Cornish's
Just identify where you're from.
Just back up a bit.
Okay. Okay. During Dr. Cornish's opening statement, he mentioned a distinct lack of protein-based nutritional provision, and for refugee camps bordering Syria specifically, and that evoked a memory of a recent report I'd seen on BBC, which discussed the Damascus. How Damascus granted sort of migratory asylum to its residents, although they did not obviously have any humanitarian convoy to assist to facilitate their travel. I was wondering what you would believe would be the best method of implementing those protein-based nutritional provisions, and whether perhaps I was thinking if GMOs have become such a controversial domestic issue, but if those could be sort of expanded internationally, and those sort of, I suppose you could say, artificial food products could be implemented in a more international context for these people who would otherwise not have the appropriate means to survive after these exoduses abroad. And I guess that's it.
So two separate questions, one on how to get it in, and then also on the GMO.
One of the big problems with assistance inside Syria is that the majority of the assistance that's been brought in has to go through Damascus. And the problem with that is not that it goes through Damascus. It's that Damascus also controls that assistance getting across the front lines and decides whether it can go or not. So you have the Syrian Red Crescent, who's doing an amazing job alongside the IDRC and the UN, that are based out of Damascus. But every time they want to cross a front line, every time they want to bring assistance that they brought in somewhere, they have to have a whole series of permissions, which makes it very slow. And actually, the majority of the population that's in need are in opposition areas at this stage. So it makes a very difficult manner to get aid across. So what we've been pushing is that aid be funneled in cross-border through the neighboring countries in order to get to those areas. The question about nutrition-based isn't centered around Syria. It's more centered upon a type of response to malnutrition that is well adapted to emergency settings but is not yet used in chronic settings. And what we've showed is that if you have a lipid-based or protein-based nutritious food given to any child under 5 that is sick, that has malaria or any other under 5 ailment, and anyone who's showing initial signs in the hunger gap period, it'll reduce their mortality by 50%. So what we're trying to get is that what's accepted in emergency setting becomes accepted in the treatment of chronic malnutrition. That then avoids stunting. It will allow children to have all of their mental capacities to be able to go to school. It stops also families from selling assets, from taking difficult decisions to go to the city to seek medicalized care, leaving others behind. So it's just really a very promising field, and it brings things down to a level that national governments can support because the cost is much lower, because community health workers can be trained to do it. It's very simple, and it can become part of their routine. And there is also a payback. That's one of the problems with a lot of early warning systems, that if you train people in a certain skill set, but they're looking for something that never occurs, or there's no payback, no reason to do it, then they stop doing it. In this case, it's helping all of their community members not end up with malnourished children and not end up with all of these other tangential issues. So they actually see a huge benefit to taking this on. So those are two quite separate things. As far as GMOs, they don't really enter into the protein problem. The problem about the types of food blends that are used is this dates back to the food aid conventions of old time and sort of our own agricultural surplus. And that may not be today's problem because in Canada we've untied food aid. But nonetheless, once you do things in a certain way for a long time, it becomes the standard way, and so it needs a real paradigm shift. We also have to work on reducing that protein to exactly the amount that a child needs to be resilient in order to get the cost down enough that aid policy will likely go along.
Would that same thing work that works in the emergency setting? It's that same thing that will work in the chronic?
It's the exact same one. The difference is the cost, and because there's so many more people in chronic malnutrition around the world, right now, governments and donors are balking at the cost. So if we could find exactly the right composition and reduce the overall cost of the nutrient package, then probably we'll have made a great distance. But it already is being adopted. It's being adopted in Niger and being adopted in other places, but we need to see it much more expanded.
Does anyone else? No?
Based on the last 50 years of experience, can you give me kind of a pragmatic view of your role of governments in developed countries, either what they should be doing or what they should not be doing in order to look ahead for the next 20, 30 years? What would be your advice pragmatically to governments? Developed countries is what I refer to, of course, not local ones.
Sorry, you mean our government, for instance?
Our government, USA, France, worldwide developed countries that are in a position to help, but also in a position to get in the way, which they often do, I think.
Yeah.
So looking at advice to developed nations, to donor countries.
Yeah. Well, if I may, and it's not only for humanitarian action, it's as well for the development in general, but the aid in general and humanitarian assistance has been quite political. It's political. It is political. And because it's political, then you are some kind of an instrument, or there's an instrumentalization, to the organizations on the perception of this potential independence and neutrality and so on. So if there is something that I can say quickly and pragmatically to my government, for instance, I would say to try to help to invest in awareness of the public of what is happening around the world, helping media and communications to be aware that, well, of course there is Syria, but there is probably hundreds of other crises around the world. Obviously, we cannot know about everything, but at least there is more awareness. And if there is more awareness, the public will be there, then it will be something less institutionalized and political and more oriented as a general community, and obviously a little bit less political. And if it's less political, then it's easier to receive money from a state, and probably that you will receive more money from the general public as well. Then you have a better diversity in your investments, and it's easier for you to work in the field. So doing awareness, helping media to have more international information is certainly, I think, one of the key, especially in Canada at this time, that I will recommend.
To me, it sounds like when you talk about awareness that you're almost talking about more politicization because
yeah, well,
because you make it an issue.
Yeah.
I have an answer for that.
Yeah, thank you.
You have an answer.
Yeah.
Just to get him off the hook.
Yeah, thank you.
Maybe he'll be nice to...
Probably it's the government.
It's the, yeah.
There you go. I'd say there are three things. One is funding evidence and research-based programming in humanitarian sphere. Not having that somewhere else, but allowing these things to develop in the humanitarian budget in situ. So
Evidence-based.
Yeah. So I think that's one. Two is by reaffirming the commitment to international humanitarian law. That will help access down the road. It's not going to switch it on a dime, but would also help erase some of the borders of this instrumentalization that Francois has been talking about. And I think the third thing they can do with the funding package, and some European governments have done this already, is to invest more in base funding of select organizations that the government wants to support. And then it wouldn't be saying, well, you work in conflict X, or you go and do this there. And that will then remove this appearance and this perception that strings are being pulled for the humanitarian assistance. So if instead of funding 18 different programs through one agency, they were to give them a base fund, they would know that funding was coming for the next how many years. Not a pooled fund. This is a specific fund to the organization. Pool funding right now, pool funding can work if it's fixed. Right now, pool funding has been brought in, but what we find, and we're in a luxury that we have enough donor support that we don't need to rely on pooled funding, so we just respond. But many of our fellow organizations who we rely on to do great work in these conflicts and in some of these humanitarian settings, they need to apply for that pool funding before they can respond. But if the earthquake was yesterday, or if the nutrition crisis is today, some of the pool funding takes 3 to 6 months before it's unlocked. So pool funding, yes, but only if it can actually be responsive and reactive. And I'm not sure that it'll ever get to be that quick, because it will be political and politicized. So if you go to a base funding instead, then you're funding a package of activities in an organization that the government wants to support. They'll have to report back, they have to be accountable, but they could be responsible for the decisions according to need alone, rather than to some of the political agendas that then make these problems of perception.
Denise?
And I would just add,
It'll come on, yeah.
Is it working?
It will, yeah.
There we go. I would just add, because I agree with what was said about funding evidence-based research, but I would add also, one of the big issues we found is that you can apply for humanitarian funding in different ways, and you can apply for long-term development funding, but when you start talking about resilience, disaster risk management, all that sort of gap funding in between the two, it's a ballpark, right? One side says, oh, we don't fund that, they fund that. Well, we don't fund that, they fund that, and you're going back and forth. So getting governments to think it differently, that it's not just about funding one or the other, but also funding prevention, funding ways, and using research, funding research that allows us to see how we build that resilience and how we diminish some of the vulnerability. It's very difficult at this point in time to have that kind of funding. There isn't really a place for it, at least in the Canadian government, maybe elsewhere, but it is a big issue.
Hello, Shem Yusuf from Islamic Relief Canada. First of all, I want to thank you all for a very engaging conversation. My question pertains to a point that all of you highlighted, actually, and that's coordination. Considering the fact that many Western NGOs are often seen as paternalistic and culturally or religiously insensitive in many of the areas, including Syria or Somalia is another example, and they have difficulty accessing many of the areas and working in these areas because of the apprehensions that local populations and groups involved and different actors have towards them. How do we ensure further coordination with organizations that do have access on the ground and that are acceptable to the local actors and populations? And if you can cite any examples of something like that that has occurred in recent times, I'd appreciate that. Thank you.
Thank you. Practical example?
I would like the practitioner response to the practical example.
Sorry? I don't think I'm enough of a humanitarian field practitioner myself. I'm more of a development practitioner, so I wouldn't be able to answer. But what I would say is I think it's something we should be working on. Somebody mentioned that it was great that we created the Humanitarian Coalition. It's something we need to expand, as far as I'm concerned, to other organizations so that we're having a collective voice to the public as well. But I do think in field it's an issue, and Stephen spoke to it a bit about saying that some have more access and we need to work with them. Always maintaining that we all need to adhere to the same kind of principles, of course. But I don't, I think that's.
Well,
I don't have concrete examples.
Practically, we're working that way today in Syria. In each area that we're working with in Syria, on our own, we have multiple coordinations and partnerships in order to be able to carry that out. And where we're not able to be ourselves, we're helping 50 other hospitals in contested areas, in government areas, and in rebel areas that we're not able to assist right now. And we assist in all of those through different members of local organizations, through community groups, through professional groups, also organizations of doctors, to find ways that are acceptable, that are culturally acceptable, and that can work in those areas. One of our big challenges is also coming to terms with the risk level that different organizations will take in those settings, and that's something that we're still working on. But with Islamic Relief, with IDRF, there are some well-known Islamic charities that we've coordinated with, received funding from in the past, and that are quite above board and quite easy to work with. There are others that are far more challenging, and you have to just decide how closely you can cooperate versus how closely you can coordinate. But if there's only one organization that can get to location X to help those people, you can be sure we'll find a way to work with them.
Yeah. Well, maybe I don't have example, but I think that a way that will help what you just mentioned as a possibility to try to reach an organization that was able to get in and the 20 or the 200 others are on the outside is also some kind of pre-agreement where there's a way that you channel donors through that organization and / resources, which sometimes is quite difficult for an organization to agree to say, well, no, Oxfam, we're not there, but call CARE or call MSF. And it's sometimes difficult, especially at the marketing department of an organization. So I think it's necessary that the organization that are mature enough to do this kind of lobby for another organization and as well have some kind of agreement like today when there is no conflict. So if something happened, at least we can coordinate our effort through one organization because this is the one that has the capacity to get in the country.
There are two things on that. One is coming back from Syria. The first time I went in March, there was almost no organizations on the ground. And the first thing I did when I came home was speak with our government and ask them to increase the funding that they had for NGOs working both inside Syria and in the surroundings, even though we wouldn't apply for that funding because working in conflict, it would be too difficult for us to appear unbiased. Secondly, there is a difficulty in having these pre-agreements that you speak of. It may not be impossible, but under CRA rules in Canada, the folks who oversee our taxation, you can't just take money from donor A and give it to organization B in that sense. There is a way in a more formalized partnership, perhaps, where you're co-implementing a program, but it isn't as easy as just saying, I absolve responsibility and we'll give it to someone else. That said, you can implement pieces of your program through local partners and others, and many organizations do.
Yep.
I just want to take a quick question from the web. How important is the role of celebrities in fundraising for disasters and bringing attention to specific humanitarian need? That question coming from Natalie at the University of Ottawa.
It depends which one.
Depends which one.
Well,
should we get Sean Penn on the phone?
Or? I think in French we are saying that it's a couteau à double tranchant. I don't know what's the double-edged. Yeah, that's it. I think some might do a very good job in general, for the general awareness of something. But I think it's, according to me, it continues to create some kind of paternalistic way to see humanitarian intervention or international development in general. To see, because normally those, I don't know the one that you referred to, but are certainly white from Hollywood, sometimes Montreal as well, but most of the time Hollywood, traveling traveling around the world, taking a black child in his hand and so on, and this and the perception and the construction of the image that it create and continue to create. According to me, it is destroying what the humanitarian organizations are trying to do, which is the totally opposite. So, in looking at this kind of image, donors will continue to perceive Africa like if it's not capable to take care of itself, and to see international Western organization as the only way to support Africa. Just to take an example of Africa, of course. So I'm not sure about that. In my class, I'm very more critic than that today, but this is what I think and I can say so far.
Just think I don't know if it's going to work. Yep. I obviously, the vedette stars bring in money, there's no doubt. But I agree with what you said. What is interesting that we're seeing more and more are we being approached by a group of African football stars, for example, or a group of African singers recently from Mali who are taking initiatives and wanting to support the programs that we're fundraising for. So that's a very interesting turn of events, and we've had several experiences recently with Baba Mal in Senegal pulling together a whole bunch of Africans who wanted to do something and are doing public awareness work. So there's a shift happening there, which is interesting.
If I can just add quickly something, again in French we say something like parlez-en bien, parlez-en mal, mais parlez-en. Well, I don't think that it applies for humanitarian assistance. It creates an image that it's simple, that you can just take a plane, travel with UNHCR and adopt people around the world. Where it's not that, and it's not what we want to promote, and I don't think that it's what you guys want to promote. So, it's the simplistic view of humanitarian action is again at the total opposite of what this real situation is. So.
I agree fully with the simplicity part. I think we have to be very honest with donors, with Canadians, with ourselves about how challenging things are. We don't. In answer to the question, we don't use that particular tactic. But just listening to some of the things you said, on one hand, how are organizations supposed to get off the public purse to get into different ways of funding themselves so they can be independent and impartial? But at the same time, you limit many of the things that they will able to be doing to get there. So just looking at things in a purely practical sense, I would find that a little bit in tension one with the other idea. Although I fully get what you're saying on an intellectual level, but I'm wondering if you're not putting people then in a bind of what can they actually do.
Is that a question back there? No? Okay. Sir?
All the interventions so far. My name is Nick Moyer, and I today have been listening to a lot of people's opinions about the trends that we're facing in the humanitarian sector, and there are some pretty big ones: the increasing local capacity in the south, the professionalization of aid. We've got a much more complex humanitarian system today, much better coordinated than before, but just under the theme of your panel, I'm wondering if you could, without making predictions that you may come to regret later, I do want to hear from you, maybe framed slightly differently, as we look at the major evolutions of the humanitarian system. What are, maybe for each of you, one fear that you would not want to see realized in terms of, say, 20 years down the road, so far enough that big tectonic shifts could happen? What are any fears you might have about the direction that things might go? And then finally, if you would dare to make something like a prediction, how do you think, just one thing that you feel your agencies or the humanitarian system is likely to adapt to? So something that would be different than what we have done, or some way that we've adapted to some of the trends that we've talked about.
So fears and hopes. Who wants to do fears?
Prediction? I feared that question.
Well, like that you're waiting for me. Well, let's talk about hope. It's easier, and it's a good question. And Nicolas, I think today it's a very good opportunity to open discussion and try to think out loud. I think that, and it's coming back to our first panel this morning, that my hope, and it's a personal hope, but I think that it's shared for many of you, is that these kind of discussion, this level of understanding will not be, I'm talking especially as a Canadian perspective, because as you all know, this kind of debates and public or more Chatham House are happening a little bit everywhere. But that we can be a better humanitarian, more responsible actor, trying to encourage discussion between and negotiation and interaction between research practitioners and hopefully politics as well, which has been a problem for many organizations in the last year. So I really wish that we can be a better actor, more proactive, building humanitarian policy that are based on evidence and that are going to be more responsive and more mature for people, a point there, but for the people living in the South, because this is why we're doing that job. This is why, you're doing that job, and this is why I study that. So that will be my simplistic hope.
On the fear side, I fear that empathy for the other is dissipating. And I think there's a number of political discourses around the world in this time of economic hardship that are playing into that. And we're treating the refugee as the other, the migrant as the other, who's trying to fight his way in to steal our healthcare or to jump the queue. And I fear that we'll focalize so much on ourselves and our own problems that we're going to fail to see the problems of the other. And it's very easy not to. It's very hard to do something about it, but it's very easy to become blind to the other. And so I think a lot of work needs to be done on that, and the advocacy and the empathy to understand the situations of people around the world. We all have our own degree of heart and of care in the circle that we can take care of, and we need to start that with our family and then our friends and our neighbors. I think if we have our eyes open to the suffering of the other truly, I don't think that our heart is so limited that it can't encompass a little bit of a wider circle, and so that would be my biggest fear. As far as what I think as a great prediction, even though Lau advised me not to, one of the things that's affecting us more and more are these epidemic outbreaks that we see, viral hemorrhagic fevers where populations are moving into new areas, where we see the expansion of pandemics. Like SARS made half the tour of the world in 17 hours, and Canada struggled to be able to manage it. When we look at the disasters that are happening in the U.S. is struggling to manage those disasters. So what I would see is perhaps more of a role in our own home societies, and we are already seeing some of our other colleagues in Europe are responding to migrants and to poverty in inner cities in Greece and in Italy. Well, we have the eyes to see our own needs. In Sandy, our team in New York ended up rallying a whole bunch of doctors and going up the 20 floors because there was no electricity. All the old people were shut into their buildings. You had the great plan and the master response plan that never took that into consideration. The relief checks arrived on the same day, and it was also the day after relief checks is when everybody refills their medical prescriptions. So you couldn't even respond to the medical prescriptions because you didn't have insurance if you were a doctor, so doctors didn't want to go and do this. It was in no one's plan. And we struggled for days to get the New York authorities to even listen to us, to know that we had doctors, that we could do it, we'd take the risk. It took Anderson Cooper to get New York City to call us back, and by that time we'd done tons of interventions in New York City. It shouldn't be needed, but I think that's where I started. The urbanization, the dependency that we have, the complexity of these emergencies. Yes, a lot of people did great work in responding in Haiti, but if you then can't do anything about cholera, in Syria many people are doing great work, but we have measles and polio. We conducted a measles vaccination in the middle of Aleppo, at great risk. But these things have to be done, and I don't think that we're at all prepared. There are great plans for dealing with pandemics, but the interrelationship of our world, the way travel is, we're undervaluing multi-drug resistant TB. We're undervaluing all kinds of other things that will come to our shores, and if we don't develop the empathy for the others on theirs, well, I think we'll wake up one day when it might be quite late for us.
Maybe I'll go on a hope then. I think my hope would be that we realize the objective of seeing more countries be able to respond to these issues. So we know when we've seen it, when things happen in a country like Japan, it's very different than in a country like Haiti. And with the number of increasing crises and climate change, I think that we need to be able to see governments being responsible to their own citizens, and making sure that they're taking their responsibilities in these situations, but that they also have the resources to do it. So it's a bit of that power shift happening. That's what I would hope to see, because otherwise, as organizations who work in this field, it's obvious we won't be able to respond to everything. So we really need to have stronger response capacity in countries that are particularly at risk in some cases. That would be my hope.
We have just a few minutes left, so we have a couple of questions from the web, but you've been standing at the back of the room first.
Hi, my name is Julia. I'll just ask real quick questions. The first one is directed towards the area of technology. I remember one of you mentioned we need more of technology within the area of humanitarian aid. And what I see is I have a background in systems engineering, and I do a lot of community work, but what I find is the humanitarian area in and of itself is very, cold to the concept of technology. Like, it's not, if I want to develop something software-wise or hardware-wise in the field of humanitarian aid, who do I go to? That area, the channel is very small. There isn't much happening. So if there has to be a future plan for organizations to invite technology and to technical collaborations, how would it be like? That's one question. And the second one is the mentioning of jobs for refugees so that they can blend well with the communities where they are living in. If you could comment a bit more on that, how can we, being donor countries, aid that process? We can fund them for food and things like that, but as a long-term investment, how do we ensure we can help them blend into the communities they are existing in right now?
So, Steve, maybe you could take question one, and Denisa, you could take question two. Yeah.
Where do you go for technology? Well, see me after this panel, and I'll give you an example. We just held our first hackathon in Europe in one of the centers that we work together with. And brought amazing computer skills around a number of challenges, and they came up in 48 hours with a new way to distribute text messaging to our HIV/AIDS patients in Zambia and Zimbabwe, and do so at a fraction of the cost. They've not only found the system to help us do this, and this will remind people of the multiple medications they have to take every day, so it'll give them a little beep when they can't miss the key moments. But second, they also found a provider that could do it at 25% of the price through their contacts on the web. So, a firm believer in innovation, and we don't have all the answers in our sector. That's clear, and we need bright minds, bright ideas. So if you have them, let us know.
I thought you'd get invited. If I look at the situation in Jordan specifically, as I said, what we're seeing is this situation is going to go on for a long time. So that's where I think we need to start taking learning from our long-term development strategies that we've done elsewhere, where we've built, programs around entrepreneurship and building small businesses and that kind of thing, service, whatever, bringing that expertise in to think of a longer-term solution than just, for example, cash for work, which works for a while, but at some point it can't be a permanent solution. So that's where I would bring in more of that long-term vision of what kind of solutions you can look at. And there are no easy answers, and I'm not saying that it's an easy thing that we have, magic responses to it, but if we don't start thinking in a longer-term way, the cash we have for cash for work will run out, right? And so we're going to have to think about different ways of approaching the problem. But you also have to be doing those programs with the community as well. because they're facing the same situation. So it's looking at having programs that are having a longer-term vision.
Question for Steve from the web. With Syria in mind, what are the issues that NGOs face with funding conflict-related humanitarian response as opposed to natural disasters?
Well, it's a really good question. In natural disasters and in epidemics, I think we have a natural empathy because we could see it happening to us, and we could see it happening to our children. When it comes to conflicts, I think I mentioned earlier, we somehow think people are responsible. It's a little more distant, a little more difficult. And in every conflict area where I've worked, when you talk to people, when it's the first time they've had a conflict, they can't believe they're having a conflict. They imagine the neighbors could have a conflict. They never believe they would have a conflict. They can't understand how it happened. They can't understand how they've become a refugee and how they've given up their job and they've had to flee their country to the neighboring country. And somehow it's difficult for us to understand that and to empathize with that. And so typically we don't even raise money for conflicts at MSF. Typically, we don't ask for conflict funding. But in the case of Syria, we'll be spending, as an organization, about $63 million by the end of this month, or not this month, but by the end of December. And internationally, worldwide, we've raised only half of that money, which is very uncharacteristic. And the way the conflict's been portrayed as something to do with terrorism and how it's been portrayed. But this conflict is a number of conflicts. It's kind of a last conflict in the Cold War. You have an intern conflict between Shiite and Sunni. You have a regional conflict dynamic all overlaid on top of that. And you certainly have the great powers on both sides picking and backing their own. But 99.9% of the population suffering in the conflict are people just like you and me. In Syria, folks lived in condominiums. They're doctors, they're nurses, they're teachers. They're living in a middle-class society when the lights go out, when there's no more health care system, when there's no ability to escape the conflict because it's actually targeting you by bombing bread lines, by bombing schools, by bombing hospitals. And so for me, I feel that the reason we don't have empathy is because I'm not telling the story well enough. If I've been there and I've talked to people, then I have a responsibility to give voice to their suffering. I have a responsibility to educate Canadians, to educate others on what's going on, and to call for assistance not only to us but to whichever charity you think you believe in and you know are doing good work. Then put your money there. And then with the government, I continually work on the government. They've been quite responsive so far, but they need to do more. And they need also to push other governments to meet their commitments to the needs there, because refugees have rights. This isn't charity. Meeting the basic needs is the least that we can do. So great question.
I think the way that things are portrayed, it plays a large role. It is farther away than, let's say, Haiti, and it's always easier when it's closer. But I'd put a call out, some kind of a call out to the media about that human side of the situation, because it's often portrayed more from the conflict perspective or the political conflict perspective, and a lot less about the actual people who, as you say, are people like you and I, and it's very specific in this conflict about the high number of middle-class people affected who become suddenly refugees overnight, which is a huge change for people. So I would put a call out to giving voice to that publicly.
They're more expensive.
We can do it.
They're more expensive to get to those people.
Definitely.
The YouTube videos of Bang 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 are out there.
Sure.
And the people are more difficult.
The anthropological donation practice is quite easy for natural disasters. I mean, it's an act of God, and that had been studied a little bit. And it's interesting because I actually worked on that last week, and the numbers are more or less 1 to 100. So for a disaster, natural disaster versus a conflict, it's not only Syria that has this kind of situation. It's overall, I think, a situation that are facing any NGOs, humanitarian NGOs around the world. That the natural disasters are easier to give because there's some kind of act of God situation where, well, it can happen, as you said, to anybody, even to us. But the conflict, someone has something to do with that. If I give money to this organization, will it help that one? And then it takes too long, and there's a yeah, that's it. It's too late. It's too late for the donation.
And with that, I think we'll have to wrap it. I'd just like to thank Denise, Steve, and Francois for being here today. It's been a real treat for me. I think someone else is now going to talk, which is fantastic. And thank you to all of you for hanging out. I know a couple of people left, but it's great to see such a big crowd at the end.
Exactly. And I just wanted to thank David as well for the wonderful job that he did. Thank you very much, everyone, for coming, for the audience on the web. And just a short note to indicate that the Humanitarian Coalition has planned a social event across the street if you're interested in going. So please join us. Thank you. Merci beaucoup.
Thank you.